Well, despite his public relations blitz, it appears that President Obama is losing the battle to win the hearts and minds of Americans when it comes to health care reform. Brand new Fox News Opinion Dynamics polls show people believe this reform will actually make things worse. Look at the numbers. Nearly half believe the quality of their care will deteriorate if these plans go through. Less than a third think things will get better. So, are their concerns well-founded? Dr. Linda Halderman is a practicing surgeon, and she's also a member of the California State Senate Health Commission. Doctor, good morning to you.
Good morning.
Thanks for getting up so early. All right, now I want to go through, I have several questions for you. So I want to go through and need relatively quick answers on these so we can get through all these important things. This is a day in the life post-Obama health care reform, according to you. How long will I now have to wait to get an appointment to see a primary care physician if we are under the new plan?
The best example of that, I think, is the plan in Massachusetts, which similarly is a public plan. We now know that the waiting times in Massachusetts are about double as in Los Angeles, 49 days as opposed to 24 just to see a primary care doctor.
Double the national average, you mean?
Double places like Los Angeles. The national average hovers around 20 to 25.
Okay, so longer wait to get in to see your primary care physician. What about a specialist like you? What if I need a surgery?
I think what's most concerning is that a lot of the decisions about that type of thing will be made far from the place where doctors work, such as Washington, D.C. There will be a group of political appointees to decide if we have enough doctors, if the types of procedures that we recommend to our patients are okay, or even if the patient should make those types of choices.
Well, so does it affect, I mean, let's say, God forbid, I get diagnosed with cancer and I need some sort of cancer surgery, and maybe, you know, a lumpectomy or something like that. One thing, logically, one feels like you can't delay that. You got to have that done right away. Is that going to be affected?
I wish that wouldn't be delayed, but what we've found out, for example, from Canada, from places like Massachusetts with a public plan, is that treatment does get delayed. And decisions like lumpectomy are often weighed by a government entity that's never examined you, never met your family, and may decide that there are cheaper alternatives that your doctor just doesn't recommend for you.
Really? So, I mean, honestly, I want to make sure that this is not spin. You legitimately feel that we could be at a point where the government is saying, all right, you've been diagnosed with breast cancer. Your doctor says you need a lumpectomy, but it's not the most cost-efficient treatment as far as we are concerned. So, Ms. Kelly, you're going to have to choose this other treatment that we think is cheaper.
It's in the bill. It's 1,018 pages, and it describes that there will be a list of coverages decided by political appointees, by a commission appointed in Washington, D.C., not in the exam room where you're looking for treatment.
You know, President Obama keeps talking about this red pill, blue pill example, saying, hey, you know, if the red pill's cheaper than the blue pill and it works better than the blue pill, then yeah, we may have a panel saying, doctors, prescribe the red pill, no more blue pill. You have a feeling on that, thinking that may not work out so well for people.
That isn't an individual approach to health care. If that red pill makes you nauseated or makes your life unlivable, why wouldn't we use a better pill, something that works for you individually? You can't make those kinds of decisions in a boardroom in Washington, D.C. Those are exam room decisions.
And what about, you know, money? The copay I pay when I go to see my doctor, or the premiums I pay to maintain my health insurance, how do you anticipate those changing for people under the new regime?
Well, there's really no better example of a public plan than Medicaid. And what has happened is costs have skyrocketed. They have gone up far faster in public programs like Medicaid than they have in the private sector. So while we can argue that cost cutting needs to happen, using a government plan to do it doesn't work, and we've proven that.
And what about senior citizens? You know, the AARP has come out and endorsed this plan. They are behind it, but you know, what, as a practical matter, how are seniors who are great users of the healthcare system going to see their lives change?
This was the most frightening part of the plan that I read. Among those 1,018 pages, every 5 years, a senior citizen has to meet in consultation with their doctor to talk about death with dignity, to talk about their end-of-life choices and whether or not they want things like hydration or nutrition. I just don't understand how mandating a conversation about death every 5 years is the type of health care reform we're talking about.
Oh, my goodness. And that begins right when you turn 65?
It does. That's what is defined in this bill as the elderly.
Can you imagine being told by the government, you go to your doctor and you talk about dying? You do it every 5 years. Most people don't want to talk about that ever. Never mind when they're actually getting, older. Anyway, we'll see what happens. This is by no means a done deal, and it is good to talk to an actual doctor who's out there in the field practicing about your views. It's one perspective on how this will affect our lives. Dr. Linda Halperin, thanks so much for being here.
Thank you.